Santa Clarita's hometown station, KHTS. I am Kyle Jellings. Appreciate you hanging out with me for this special City of Hope Hour. Once a month, we get together and talk with different people from the City of Hope to talk about the awesome things that they do in our community. cityofhope.org/Santa-Clarita is how you can learn more, or you can, of course, keep listening because we're going to talk to some special people right now as well. We have two very special guests in studio. We have Mandy Eglseder. Did I get it?
You did.
I got it. All right. So I got Mandy Eglseder. We have that in studio as well. And then we also have Dortha Chu, Dr. Dortha Chu. And Dr. Chu is with us. And you are the, I'm going to say this right, Diplomate of the American Board of Surgical Oncology, with emphasis in breast cancer, right?
Correct.
That is correct. Okay. And Mandy, what is your title? You are the Physicians Relations Liaison?
Yes, I am the Physician
we're actually having
Liaison for the City of Hope location. So we're right across from City Hall, and basically what I do is I work with our physicians in the community and our physicians at City of Hope. So everyone knows what services we have here and that we're here to help.
So let's get into that a little bit. Dr. Chu, we'll get into your stuff a little bit as well. We're going to talk a little bit about specifically your background, how you ended up at Circle of Hope, City of Hope rather, at City of Hope, and then also why you decided to take this angle. But first, let's get into a little bit of what type of things are offered at the City of Hope. And defer to Mandy.
Of course.
If you don't mind.
All right.
Not at all. Not at all. Not at all.
So we offer everything from medical oncology, hematology. We have breast surgery, gynecological oncology. We have urology, and that's general services, and urologic oncology. It's a mouthful. Yeah, and our physicians at City of Hope are both privileged with Henry Mayo and Providence, so we're here in the community. Our goal is for the patient, especially if they are diagnosed with cancer, that they can just stay in their community and they can get treated in their community. We're here to work with everyone. So. And
what is I know Carl was saying you have a background really with, I don't know how to say this, the cancer community? Is that how I say it? You've worked with different organizations in the past. What is your background?
So cancer has always been something for me that I've, it's been a part of, everybody's been touched by cancer, right? For me, there's personal reasons. I do this for my stepdad in memory of him. I got involved a while ago with the American Cancer Society, Relay for Life. We're involved with Circle of Hope. We're involved with many nonprofit cancer organizations here, and I feel very strongly about the fight against cancer. So to be here at City of Hope and helping connect patients to comprehensive cancer care is really important to me, especially seeing the journey that cancer patients go through to not have to drive, and just the convenience of staying in the community is really important. So helping with that process is just something that I really care about. So
you've always been involved with different cancer organizations?
Yeah, for quite some time. So I actually, my background is from the American Cancer Society. I was there for quite some time, and I wanted to be more involved on a patient connection to patient to physician connection level. So here I am at City of Hope.
Yeah, and there we are. And
and we're so happy to have you.
Yeah. Thank you. And one of the cool things about City of Hope, like you said, the community, the doctors live here, and the staff cares about our community, and that's one of the awesome things about the City of Hope. Again, you can go to cityofhope.org/Santa-Clarita to learn more about the services they offer. And if you're dealing with any type of cancer, really, right? And if you're dealing with that, they help out with family. And if you've already been diagnosed, I know from personal experience that if you have already been diagnosed, you can go to City of Hope and get a second opinion and learn about all your options.
Absolutely.
Yeah. An informed patient is the best. I mean, if you are going through cancer, It's good to know as many possible options and collect as much information as you can so that you as a patient can decide what's the best for you. Only you know what's best for your body and what's best for your lifestyle even. So.
And that's the one thing about talking with doctors. This is the third show we've done. I've talked with doctors and they're like, it's not like a one-size-fits-all type of a situation with cancer. So that's a really appreciate that. Dr. Chu, I wanted to get talking to you a little bit. And I want to talk a little bit about your background. Where did you go? Where did you grow up? Where did you go to school? All of those things.
Sure.
Let's start at the very beginning.
Start at the very beginning. So X number of years ago, we won't say how many. I actually grew up in the Bay Area.
Okay.
So I'm a California girl.
Okay. A different type of California up there in North.
Different, a little different. I'll give you that, but still California girl. And went to school, went to college at Berkeley, and so I stayed local.
Okay.
But I wanted to experience a little bit of the rest of the country. So I did my med school and graduate school education in St. Louis at Washington University. So got a little taste of the Midwest winters and realized that was not for me.
How was the barbecue in St. Louis?
Oh, the barbecue was great.
That's what I've heard.
Yes, the food was good.
Okay.
The weather, not so much. At least not for this California girl. And so,
I got you.
So my very first opportunity to come back to California, I did. So I went to UC San Diego for my general surgery training.
Okay.
And then after that, I kind of looked around for a job and really wanted to stay in California. My family's still in the Bay Area, so I actually have been working, started a private practice up in the Central Valley in Merced, so that I was close enough to the family to be,
I gotcha.
accessible, but not too close.
I have family that live in town. I know exactly what you're talking about.
But that worked out really well. So I was a general surgeon there, and I kind of did a little bit of everything when I first started out, and got to know my patients. And it was a smaller community than Santa Clarita, but still had that nice small town feeling that I wanted to be a part of. And it was there that I realized the problem sometimes with small towns is that access to care can be a problem for patients, and both in terms of what is available in their local area, but also being able to travel a distance in order to get a higher level of care should they need it. And I've always been interested in cancer. Didn't necessarily think that I was at that point ready in my life to sort of commit my life to it, but I was always interested in it. And so when I really saw it was that a lot of the patients in the local area had a hard time getting access to quality cancer care, especially in the area of breast cancer, which I did treat as part of my practice, although not specializing at the time. And it just sort of stirred a little fire in me.
When was it like you were born and like, I'm going to be a doctor? When did you realize that you wanted to be a doctor, or when did you realize that you wanted to get into the medical field?
For me, it really was not necessarily something I thought I would be doing when I was, kind of growing up. I always wanted to be in a field somehow that was going to be of service. I think that's sort of the best way to put it. So I thought about being a teacher, being a doctor, nurse. I mean, all of those fields were sort of things.
You picked the one that takes the most school, just like.
Well, that actually, you're right about that.
You're like still in school, I think.
You know what? That's part of it, actually, to be honest. It was an element of that. I wanted to be in a field where, for my personal growth, that I was always going to be learning something new, that it was never going to be stagnant. And being in medicine, you're never going to learn everything. And there's always room to learn more. And we're always finding out new things. So that's the excitement part of it for me, to be involved in something that was always changing. And so that kind of, for me, coalesced when I was in college, looking around, kind of getting really serious now about what I wanted to do, and realized that
make those grown-up decisions.
Exactly, and be a grown-up.
My least favorite type of decision was the grown-up one.
Exactly.
Yeah. Oh man.
So, since I had to make one, it seemed that being in medicine sort of hit all those notes. I was going to be able to have a life of service, but for that kind of a reason, but also for me personally, like I said, just lifelong learning. I knew I was going to do that, and I like being in school, I guess. So that appealed to me on all sorts of different levels. So after college, that was when I got serious about pursuing it and went into med school.
And you got into med school, and you're in Merced. You're running your general practice, right?
Yeah, general surgery practice.
Yeah, general surgery practice. And then what was it? Was there a specific incident? Was it just you saw a lot of it? What interests you about cancer specifically?
Yeah, so I was treating breast cancer patients sporadically as part of my practice. So I would get sent those every once in a while, and they really struck a note for me. I felt that I could relate to them on a little bit different level than some of my colleagues, being a woman, and touch and having my life touched by breast cancer as well. I had an aunt who was diagnosed years ago, and so I saw firsthand, how devastating sometimes the treatment, not just the diagnosis, but sometimes the treatment can be if they're not necessarily offered the full range of options. And so I saw that firsthand with my family, and then I started to see that play still with my patients. And this is years after my aunt had her diagnosis and treatment, and at her time, options were limited. Now there were so many other options for patients, but they weren't being offered that because our community was limited.
Gotcha.
In terms of what other physicians were able to and willing to offer, as well as being able to send them someplace where they needed to go and they couldn't do it. They either didn't have the resources to do it financially or socially, and so it really I saw that and it hit something in me that I just didn't think that was right.
Yeah.
For patients to be limited because of those reasons. If there's any way I can do to help. And then my own personal reason, like I said, I was always interested in cancer. And this is one of the fastest growing fields. I mean, talk about, never learning everything and always having something new. It really was a great transition for me personally to sort of say, this is something I could do that would be different. And that I think I have some special sort of circumstances in my life that makes me relate more to these patients. I can do more in this area. Anyone can fix a gallbladder and take it out. Anyone can fix appendicitis.
Just to be fair, I cannot do that.
I can't either. It's fine.
Just so you know.
Anyone who's been trained can do that. Let's put it that way.
That's an important qualifier.
But I felt that because of, like I said, some of my own personal interest, this is an area I could really, I think, do more with. And so I changed my practice and I dedicated my practice only to treatment of breast and diseases, not just cancer, but breast diseases in general, with a focus on cancer.
Okay.
And so I did that for the last 8 years or so, and helped my. And I'm happy to say and proud to say that I think I helped my community at that time to really develop some of the tools and services necessary to support that. So we were able to bring some of these services to the community and keep them in the community and keep patients in the community to get the kind of treatments they needed at the level that they needed. Not all, obviously, but enough that the majority of my patients were able to get what they needed in town without having to go away. That includes medical oncology, radiation, etc. So all of that was great, and I was very happy doing that.
That's awesome.
But there are limits to what a small town can support.
Yeah.
I missed the academic setting. I missed having access to that a little bit, more advanced techniques, more
and that is
advanced
something.
options.
That is something, and you're probably alluding to this, but
Yes.
City of Hope certainly
Absolutely.
pushes research a lot, and there's a
Absolutely.
lot of doctors that go there simply because of the research you guys do.
Well, we pride ourselves on that because it helps to open doors. It helps to develop new therapies and options for patients.
Mm-hmm.
So I think it's a crucial part of what our organization does. But what really, to be honest, attracted me to it is the community setting that we've now developed. Most people, I should say, probably know City of Hope as the big campus in Dortha, and the concept is, well, you go there for your treatment because you're right, we have everything there. But most patients don't need to be there. If their cancer can be treated at the local level, it's so much more convenient if they can be.
Absolutely.
And so City of Hope a few years ago has kind of changed the way they approach that and developed these community centers like ours here in Santa Clarita to try to provide as many services locally as feasible and as supportable by the community, so that patients can stay and not have to go to Dortha or anywhere else if they don't want to or need to. So that for me actually was what drew me here to Santa Clarita, was that they have such a strong community focus that I really wanted to be a part of that, and having the research as a backup and having access to the clinical trials and the research opportunities so that if patients need that, it's available. I think it's just been a great partnership, and I'm very proud to be part of that.
This is the City of Hope Hour on your hometown station, KHTS. cityofhope.org/Santa-Clarita. We're speaking with Mandy Eglseder.
Got it.
There it is, Eglseder.
You got
And
it.
Dortha Chu, she is the doctor of the American Board of Surgery, Surgical Oncology, with an emphasis in breast cancer. So she's a breast surgeon, which is,
Yes.
I lobbied to get that on her business card, but that did not work. I wanted to ask you specifically about, and so how did you find the City of Hope? While you were in Merced, did you knew of it, of course, but and then did you see this community? You wanted to come here, and that's how it happened?
Kind of. Actually, when I was a resident doing my training in UC San Diego, one of the places that we rotate through to get experience, especially in cancer, was City of Hope.
Okay.
So as a resident, I had spent a couple months at the main campus. This is before the community sites were developed, so I'm dating myself now. But it was such a wonderful experience. So I had a great impression of City of Hope. It was a great organization. I knew, it was one of those things that I thought, someday if this is something that I was going to go into, this would be a great organization to work for. But didn't think anything of it at the time. I was, too young in my career. So when I was kind of looking at my options and realizing that I was starting to feel a little more limited in my private practice and what I could accomplish, the opportunity came up. The physician who was actually running the program at that time, this was about a year or so ago, was actually someone that I worked with when I rotated through City of Hope. So there was a little bit of a personal connection.
Oh, nice.
And so he and I started talking, and this was Dr. Tresal at the time, and he and I started talking, and he shared with me his view of what the community practice really is, which is this developing the services here locally and really focusing on the local community, which is exactly what I've been doing and wanting to expand, and it just seemed after talking with him, it just seemed like such a wonderful way to marry my interests, both in terms of community level care, but having access to that higher level should I need it. It's just been a great experience.
Fantastic. And I wanted to ask you in regards to breast cancer.
Yes.
Is it one of the more? It seems like it is, but that could be my small worldview coming to the forefront. But is it one of the more common cancers?
It is. In women, it's the second most common cancer in women. Skin cancer, by and large, is still the most common cancer for everybody.
Yeah.
But for women, it is one of the premier cancers one of the most common cancers that they can be diagnosed with. Roughly 1 in 8 women in their lifetime will develop breast cancer. So that's not a trivial number.
Yeah, no kidding.
The good thing about it, though, is that these days we've developed great screening techniques with the mammogram and as well as some other modalities that has allowed us to really find most cancers early if we can just get women to get their screening. But if we find it early, it's almost always curable now.
Yeah.
That's the advances that we've made, and we continue to make advances in that segment.
So what is and this is just my own curiosity. My grandmother had breast cancer, and I want to say I was like 4 or 5 years old. So this must have been about 25 years ago.
Okay.
And she had to get a double mastectomy.
Right.
And has that changed? Was that a common practice back then, and that's changed since, or what's
Absolutely.
What's the
Absolutely.
difference now?
Well, 25 years ago, we were still in the early phases of understanding how breast cancer, or any cancer really, develop. And so we had pretty crude tools.
Yeah.
What I mean by that is surgery was sort of the primary goal was if we just cut everything out and remove as much as we can, then that's our best chance at making sure the cancer doesn't come back.
Yeah.
And that often involved a lot of surgery. So bilateral mastectomies was quite common, and as well as other kinds of surgeries related to that. And women survived, but they survived with a lot of deficits afterwards. Weakness of their arms, deformities of the chest. I mean, there were some pretty devastating physical effects. Yes, they were alive. Yay, we're all very happy
I'm
about.
happy about my grandmother still
But
kicking.
it was very hard on the survivors. Since then, in the last 25 years, we've just learned so much more about cancer in general, but specifically about breast cancer, so we don't have to do as much.
Well, that's a perfect transition. We're going to take a break, and we're going to talk more about that. This is the
Absolutely.
City of Hope Hour on your hometown station. Mandy Eglseder is with us, Physicians Relation Liaison, and Dr. Dortha Chu, excuse me. That's probably the first time anybody's ever said that. Dr. Dortha Chu, the breast surgeon. And so we're going to take a quick break, talk more about breast cancer specifically right after this on your hometown station, KHTS.